Airbound and Narayana Health complete 700+ drone flights, planned medical logistics corridor in Bengaluru. Pilot enables up to 20 flights per day on a 4 km aerial route, completely replacing a batch road model of 3 to 4 transfers daily. 700+ flights, up to 40 samples per flight, 0 failures, operating on demand across 54 consecutive days. Following the pilot, Airbound and Narayana Health plan an aerial corridor between Electronic City and Banashankari. The partners plan to expand aerial medical logistics routes across Bengaluru, with further expansion planned to the rest of the country, beginning with Kolkata. Bengaluru, 17th March 2026. Narayana Health, a leading healthcare service provider, and Airbound, a Bengaluru-based aerial logistics company, have successfully completed a medical logistics pilot connecting Narayana Health's Chandapura clinic to its central laboratory at Narayana Health City in Electronic City by air, demonstrating how aerial logistics can dramatically improve the speed and reliability of diagnostic transport across urban healthcare networks. Running since January 2026, the 4 km aerial route is completed in just 10 minutes, compared to significantly longer road transfers dependent on Bengaluru's traffic conditions. Over the course of the pilot, the route completed more than 700 flights across 54 consecutive operational days, carrying up to 40 diagnostic samples per flight with 0 failed deliveries, demonstrating the reliability of drone-based logistics in a live clinical environment. Before the pilot, diagnostic samples from the Chandapura clinic were transported to the central laboratory in 3 to 4 road transfers per day, with arrival times varying depending on traffic conditions. The aerial route now operates on demand and on schedule with up to 20 flights per day, allowing laboratories to receive samples continuously rather than in fixed batches. Within 3 weeks of operations, Narayana Health removed the road transfer entirely, making
a 5 kg payload at about 12 to 13 paise per kilometer. This makes us more cost effective on a per kg kilometer standpoint than a fully loaded plane. This makes us more cost effective than trucks loaded with 5 tons. What we believe can happen is you can use fleets of these drones to do deliveries instead of what has to be done with heavy trucks, with heavy payload vehicles. As you scale this technology up, with a 100 kg payload drone, you can now be cost competitive with 20-ton trucks. You can replace freight. If you're able to get these unit economics, then you can move people as well. You can have someone fly from the Bangalore airport to the center of the city right here. And it's not about just being able to do that. It's about the price point. Because if this works, you can do this for just 50 rupees. And that completely changes things. We're not interested in changing the behavior of the top 1% of India. This is not about changing the way people who would otherwise use Uber Blacks or stay at 5-star hotels operate. This is about changing. If you want to lift a kilogram of payload, you need a 5 to 6 kilogram drone to do it. We've been able to do it with a 1.5 kilogram drone. And what we want to move towards is where a drone can lift more than it weighs. This is something that nobody's been able to do so far. And it happens because of the material science that we're, right? It is because of the carbon fiber structures that we've created that you can have an aircraft this big that you can comfortably lift with just one hand. The entire structure that we have here
workers have a health savings account. It's a dedicated zero balance account. Instead of tipping them, you can tip that health savings account of your maid or a driver or any of the gig workers you're dealing with. That money can be used for the purpose of healthcare, like paying the premium of health insurance. We believe that with the health savings account, with the price of 1 cup of coffee, that's about 15-16 rupees per day, the family can be covered up to 3 lakh rupees with the health insurance. We believe that with 50 rupees per day, that is price of one masala dosa, a family can be covered up to 5 lakh rupees for any of the medical treatment, up to 1 crore rupees for any surgical treatment.
ನಾವೊಂದು ನಮ್ದು ಟೈಅಪ್ ವಿತ್ ಏರ್ಬೌಂಡ್ ಅಂತ ಒಂದು ಡ್ರೋನ್ ಕಂಪನಿ ಇದೆ, ಅವರೊಟ್ಟಿಗೆ ಟೈಅಪ್ ಮಾಡಿದ್ದೇವೆ. ನಾವು ಬನಶಂಕರಿಯಲ್ಲಿ ಹೊಸ ಆಸ್ಪತ್ರೆಯನ್ನ ಕಟ್ತಾ ಇದ್ದೇವೆ. ಇನ್ನೊಂದು 2 ತಿಂಗಳಲ್ಲಿ ಅದು ರೆಡಿ ಆಗುತ್ತೆ. ಆ ಆಸ್ಪತ್ರೆ ಸ್ಮಾರ್ಟ್ ಹಾಸ್ಪಿಟಲ್ ಅಂತ ಮಾಡಿದ್ದೇವೆ. ಅದರಲ್ಲಿ ಎಲ್ಲ ಬ್ಲಡ್ ಟೆಸ್ಟ್ ಮತ್ತೆ ಬ್ಲಡ್ ಸ್ಯಾಂಪಲ್, ಬ್ಲಡ್ ಟ್ರಾನ್ಸ್ಫ್ಯೂಷನ್ ಇದೆಲ್ಲ ನಮ್ಮ ಮೇನ್ ಹಾಸ್ಪಿಟಲ್ ಎಲೆಕ್ಟ್ರಾನಿಕ್ ಸಿಟಿಯಿಂದ ನಾವು ಡ್ರೋನ್ ಅಲ್ಲಿ ಶಿಫ್ಟ್ ಮಾಡ್ತೇವೆ. ಅದಕ್ಕಾಗಿ ನಾವು ಸರ್ಕಾರದವರ ಪರ್ಮಿಷನ್ ವೇಟ್ ಮಾಡ್ತಾ ಇದ್ದೇವೆ. ಅದಾದ ಕೂಡಲೇ ನಾವು ಟ್ರಯಲ್ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ತೇವೆ. ಆದ್ರೆ ಅಡ್ವಾಂಟೇಜ್ ಅಂತ ಹೇಳಿದ್ರೆ ನಮ್ದು ಬ್ಯಾಂಗ್ಳೂರಿದ್ದು ಎಲೆಕ್ಟ್ರಾನಿಕ್ ಸಿಟಿ ಲ್ಯಾಬ್ ಇದೆ ಅಲ್ಲ, ಅದು ಇಟ್ಸ್ ಒನ್ ಆಫ್ ದಿ ಮೋಸ್ಟ್ ಅಡ್ವಾನ್ಸ್ ಲ್ಯಾಬ್ ಇನ್ ದ ಕಂಟ್ರಿ. ಎಲ್ಲ ಆಸ್ಪತ್ರೆಯಲ್ಲೂ ಸಣ್ಣ ಸಣ್ಣ ಲ್ಯಾಬ್ ಮಾಡಿದ್ರೆ ಕ್ವಾಲಿಟಿ ಇಶ್ಯೂ ಎಲ್ಲ ಬರುತ್ತೆ. ಅದಕ್ಕಾಗಿ ಸ್ಯಾಂಪಲ್ಸ್ ಅನ್ನೆಲ್ಲ ಡ್ರೋನ್ ಇಂದ ಶಿಫ್ಟ್ ಮಾಡಿದ್ರೆ ಎಲ್ಲ ಆಸ್ಪತ್ರೆ, ಬ್ಯಾಂಗ್ಳೂರಲ್ಲಿ ಮಲ್ಟಿಪಲ್ ಹಾಸ್ಪಿಟಲ್ ಇದ್ರು ನಮ್ದು, ಎಲ್ಲ ಆಸ್ಪತ್ರೆದು ಸ್ಯಾಂಪಲ್ ಎಲ್ಲ ಒಂದು ಕಡೆಗೆ ಬಂದ್ರೆ ಕ್ವಾಲಿಟಿ ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಆಗುತ್ತೆ, ರಿಸಲ್ಟ್ ಅಕ್ಯುರೇಸಿ ಎಲ್ಲ ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಆಗುತ್ತೆ, ಕಾಸ್ಟ್ ಕೂಡ ಕಡಿಮೆ ಆಗುತ್ತೆ. ಸೊ ನಾವು ಆಲ್ರೆಡಿ ಒಂದು 700 ಸ್ಯಾಂಪಲ್ ಶಿಫ್ಟ್ ಮಾಡಿ ಟ್ರಯಲ್ ಮಾಡಿದ್ದೇವೆ. ರಿಸಲ್ಟ್ಸ್ ಆರ್ ವೆರಿ ವೆರಿ ಗುಡ್. ಸೊ ಇದನ್ನ ನಾವು ಎಕ್ಸ್ಪಾಂಡ್ ಮಾಡ್ತಾ ಇದ್ದೇವೆ. ನಮ್ಮ ಎಲ್ಲ ಆಸ್ಪತ್ರೆ ಇಂಡಿಯಾದಲ್ಲಿ, ನಮ್ಮ ಎಲ್ಲ ಆಸ್ಪತ್ರೆಯಲ್ಲಿ ಕ್ಲಿನಿಕ್ ಮಧ್ಯದಲ್ಲಿ ಸ್ಯಾಂಪಲ್ ಎಲ್ಲ ಡ್ರೋನ್ ಅಲ್ಲಿ ಶಿಫ್ಟ್ ಮಾಡಲಿಕ್ಕೆ ಟ್ರೈ ಮಾಡ್ತೇವೆ.
ಸರ್, ಹೊಸ ಹಾಸ್ಪಿಟಲ್ ವಿಶೇಷತೆ ಏನು?
ಇಟ್ಸ್ ಎ ಮಲ್ಟಿ ಸ್ಪೆಷಾಲಿಟಿ ಹಾಸ್ಪಿಟಲ್, ಎಲ್ಲ ಸ್ಪೆಷಾಲಿಟಿ ಕೂಡ ಇದೆ. ಅದರಲ್ಲಿ ಲ್ಯಾಬ್ ಮತ್ತೆ ಬ್ಲಡ್ ಬ್ಯಾಂಕ್ ಇಲ್ಲ, ಅದನ್ನ ಇಲ್ಲಿ ಬ್ಯಾಂಗ್ಳೂರು ಹೆಲ್ತ್ ಸಿಟಿಯಿಂದ ನಾವು ಕವರ್ ಮಾಡ್ತೇವೆ.
Very excited to be, partnering and scaling up with Narayana Health. I think our hope is that, both the pilot that we've done in the Chandapura clinic and the pilot that we're going to be doing in Banashankari give a great case study for, India and also for the DGCA to enable scaled drone deliveries across the country. We want to move towards a world where drone delivery is not an event like this, but drone delivery is just a normal everyday part of life. And that's what we're really excited to create with Narayana.